That's right. Another key concern is the number of cases requiring hospitalization. An emergency room doctor here says they are seeing more COVID cases and they're seeing more patients that need to be sent to the intensive care unit. The work has been difficult and daunting in Harborview's emergency department as the number of coronavirus cases continue to climb. Just last week, Dr. Adayenka Adedipe lost a patient.
Unfortunately, I had to tell the family that given the current circumstances, they were not allowed into the room, that myself, my trainees, my colleagues, we had a moment of silence for their loved one on their behalf, and the family cried. It was really, really hard.
After an emotional 8-month battle against the virus, doctors and nurses are now dealing with another surge of patients.
What is it like for frontline? What does that fatigue feel like?
Well, the fatigue is hearing maybe a story in the national media from leaders that doesn't jibe with what we're seeing.
What they're seeing in the emergency departments is detailed in statewide coronavirus data showing nearly 11,000 hospitalizations. King County is among the 5 counties highlighted in dark brown on this map where hospitalization numbers have been the highest.
Several of my colleagues have been exposed. Several hospital employees have been exposed and are out. We do need to figure out how to staff the emergency department appropriately when people are sick or need to quarantine.
There's also this, a poll from the American College of Emergency Physicians and Morning Consult released in late October. It found more than 87% of emergency physicians reported feeling more stress since the start of the pandemic.
I take care of patients every day who are sick and are going to the ICU and are dying. Wear your mask for yourself, for me, for your communities, for your loved ones.
That's this doctor's request as hospitals brace for what's coming next. Now, another hospital that says they're dealing with staffing issues too is Overlake Medical Center. They say as there's more cases in the community, more staff either have tested positive for COVID or just been exposed to it. And of course, that means they need to quarantine and stay away from work. One more note from the doctor we talked with here. He said the staff has been phenomenal through this entire pandemic. And he says they have been able to learn a lot about the virus leading up to this point. Live in Seattle, Natalie Swaby, King 5 News.
Some pretty amazing workers there, Natalie. Thank you. Meantime, the CDC is issuing new recommendations about the quarantine period for people exposed to COVID-19. The agency says people can end their quarantine after 10 days if they have a negative test and no symptoms. The CDC says quarantine can also be discontinued after 7 days with a negative test and no symptoms.